A couple days ago, I had a shift where for 8 hours, my patient was in pulmonary edema. We couldn't figure it out, so she was choking on her own secretions, and I was continuously suctioning her for 8+ hours trying to figure the scenario out. I was literally torturing her and I felt so bad, but it's something I had to do to save her life. That's all part of ICU, so you better be ready for that if you want to partake in this specialty.
I gotta go. I've been working, told them please don't hit my phone. I'm in my zone, bruh, just leave me alone. Was on the road, but I swear I'm coming home. Now the drinks on me, I think we need a toast. See, I did it for me. Now my old friends calling, told them nothing's for free. Told me time is money, dog, swear I paid all my fees. I was starving for this game, now my family can eat.
Welcome everyone, another episode of the Couple Nurses podcast with your hosts Matt and myself, Peter. Some housekeeping, make sure y'all check out couplenurses.com. We keep all our show notes there, all our blogs, everything nursing related, our travel checklists, and also our NCLEX stuff. Just all our information is literally all on there for y'all. And don't forget to check out also wearefrontlinewarriors.com as well. And if you go on our wearefrontlinewarriors.shop, you can scoop up a shirt like Matt's wearing. That's actually couplenurses.com shop. JK. So Matt's wearing actually the last month's merch, which is the Couple Nurses shirt on a couplenurses.shop. It's pretty legit. It's one of our popular sellers here.
I love it. I would wear it for a dinner.
You should for sure
for
wear
a date. That's how hot this is.
And I'm wearing the actual We Are Frontline Warriors shirt. It says Be Well. And We Are Frontline Warriors is our sister site. We keep all our mindfulness, wellness, blog posts on there, just trying to grow a better human consciousness, you could say. And also something coming out here soon is Pronto. Check it out, prontohealth.com. It's an app that we are building and continuously working on that's going to revolutionize and innovate travel nursing, and you could say the whole healthcare industry in general, regarding jobs, how you get from one location to another, how you progress in your studies, how you do your certification. It's going to have a lot of good stuff for every nurse out there, and we just wanted to give that out to the world just to make life a little bit more convenient. We know how stressful nursing is, so we want to give that app out to everybody. It's going to be available for anyone that signs up. What's up, Matthew?
I love how these intros are always raw, never pre-recorded. They always get better and better. But on today's episode, we're going to talk about the pros and cons of being an ICU nurse. It is a gift, blessing to see patients in their most dire moments, family, during life-threatening situations. So we're going to discuss both the negative and positive aspects of that and the overall impact on us, on how it's been being a nurse for so long. And maybe you'll be inspired to become an ICU nurse after listening to this podcast. So it has different benefits and all that versus like tele ICU. I remember my first experience seeing an ICU nurse. I'm like, damn, this is intense. As a new grad was when my patient, I called a rapid on him, and all he had was a right foot IV peripheral. And
was it IO?
No, just a peripheral. So I took the patient down, and this ICU nurse like, oh my God, he needs to have a PICC line. What's going on? Like, she was just so intense with everything happening, and I'm like, whoa, like this nurse just has it handled, knows what to order. And I was impressed by just the level of knowledge that she knew, which really drew me into wanting to really be an ICU nurse.
That's really cool. I'm glad you said it like that, because you literally like developed that in the hospital. And it's kind of how you grow as a nurse. Majority of nurses start off in like med-surg, tele, maybe step downs, and then moments like the moment that Matt had where an ICU nurse comes up to help or an ER nurse comes up to help really shows you the other aspects of nursing. Because most of us, when we leave nursing school or finish nursing school, we enter the nursing industry. So we usually apply to hospital, get a job, and that job is basically all we know of nursing, because you orientate for like 3 months and then you get your bearings within like the first year. So you've already spent a 1 full year as a nurse on one unit. So you kind of start to lose the other nursing that you're not doing, like the stuff that you did in nursing school, some of the theory regarding the topics and issues regarding patients in other units. So it's always cool to kind of get a refresher, because a lot of times we're scared to leave our home unit, the first thing that we started off because we're not sure what's going to happen. But moments like the ones Matt had, that a nurse comes in and kind of inspired you to kind of check out the ICU because you really like the way she handled the situation.
Yeah. And honestly, I love what I do. I enjoy ICU nursing. I wouldn't want to do anything else as far as nursing as of now. I really enjoyed that aspect of what it has to offer, seeing the worst of the worst, just being so involved in like every little meticulous thing, orifice, drop, whatever comes in, comes out. We know it all. And it's honestly like doing science at work. It's an experiment at the end because there's so much happening. Your patient is de-escalating. Maybe he needs a Lasix drip, a dose of that. CO2, he's in metabolic acidosis. He needs a couple amps of bicarb. It's just so fascinating seeing the science involved. And before we even start the episode, talk about pros and cons. That's like what I love most about it is that 5 patients versus 1, that depth of science. And that's what I like really initially got into it for because I enjoy science.
Yeah, and I feel like it's a big history thing too. Because do you like history too?
I enjoyed history ever. Yeah.
Because I feel like nursing
Look at our Cup of News episodes. Always about Russia, news, Iraq, petrodollar, you name it. We love it.
Everything. So that might be what pulls you into nursing because nursing is science and it's history too. Because it's almost like the new information that's presented to you, like the stuff that the patient is going through, signs and symptoms, all that kind of stuff. That's like the science of it, the like the nuances. And then the history is more of like you being like the scholar, looking through his charting, like, hey, this happened because of this and so on and so forth. You learn the cause and effect, but it's like you're learning it through their history, but applying science to history to figure out how the patient got here and how we could make him better to have him go to a different floor. Yeah. But I like just going back to your story again. Like imagine if that nurse, the ICU nurse that you mentioned, imagine if your interaction was negative, it was bad. So I just want to stress the importance of being nice to your coworkers and not talking down upon other units and things like that, because we should all try to inspire like everybody, you know. So you should always try to just be nice and be a genuine person, because there's no reason for you to talk down a different unit. Because if you would have had a bad experience with this nurse, you probably would have been like, oh, this is how ICU nurses are. If ICU nurses are all like this, I don't want to go ICU, I'm gonna go ER.
Very good point.
Yeah, so
and that's one of the first pros. Like if you like science, you can be completely involved in the science aspect of things and collaborate. If you're on days, you can say, hey, this is going on. I'm seeing the rise in creatinine. Let's order this. You get to involve with the whole interdisciplinary team, and you really learn so much. And if you want to get into being an NP and all that and furthering education, this is a very like critical standpoint, because you're going to learn the big picture versus doing med surg. You were more focused on task-driven things versus the science, and I become an NP and you have to do more of that sciencey based things because you're putting in orders. Yeah,
learning is definitely the biggest pro, and that's kind of what attracted me to the ICU as well. Think about it this way. So you're in nursing school, you go through fundamentals, you go through health assessment, and you learn about different systems, how they work and how they come together. And nursing is literally combining all those books into each patient, because for each patient you incorporate health assessment. So everything that you learn in health assessment, you're basically breaking it down to the fundamentals, the basics. You're applying it to your patient. Lung sounds, heart sounds, blood pressure, heart rate, bowel sounds, all that kind of stuff. That's your health assessment. And then fundamentals comes into it as well, because you got to figure out what does what. The liver does this, the kidneys, you got to look at their creatinine clearance, you got to look at their BUN, the heart, you got to look at certain numbers, certain parameters, and you apply all that stuff, but into one patient each time. So it's almost like a new book and a new class in nursing school in each patient.
Yeah, and that's what it was when I started as a med surg nurse, having 5 patients always running around feeling like, you know, refreshments and narcotics.
Yep.
And if you like science, you want to dive more into that. One patient has it all, because that's what we read. We're being detectives. It's so fun. It's like being a cop, but instead of fighting crime, you're fighting in the name of science, trying to help this person. You're fighting bacteria because he's septic, right? Figuring it out.
Yeah, and then you learn a lot of stuff about collaboration too. And like the med surg floors, the tele floors, there's collaboration on there, because you have to get a lot of stuff done in a short amount of time. But in ICU, there's like a different kind of collaboration where it's more of collaboration in a sense that you're trying to figure things out, not necessarily doing things, because you're not sure how your patient responded to some medication, or if you're not sure what to do, you usually like ask the nurse next to you, the ICU nurse, and you kind of figure out certain things instead of just like calling the doctor right away. So collaboration in that sense, and also like collaboration, I feel like we help each other out with like their outside problems too. I feel like since ICU nursing is really stressful, and people are very heated and very, you could say, emotional during certain things, I feel like that almost allows them to be a little bit more vulnerable. If that makes sense.
Yeah, we hear our patients so much.
I'm talking about like nurse to nurse.
Nurse to nurse.
Yeah, I feel like working in the ICU and seeing like the worst of the worst and kind of like working with that stuff, I feel like it brings
Stronger
down some shields. Yeah, and you're more open to things because it's just like you realize that, hey, like if you have patients that die like in their 40s, you're like, hey, like maybe you think of like more in like a time scale where it's just like, if it's bothering me, if it's on my chest, I might as well just talk to somebody about it and be open about it. Like, you know, kind of what I'm getting at.
Yeah, I like that.
Thank you.
You become more vulnerable.
Yeah.
Another pro of that is having access to the medical team. So we have intensivists in most ICUs where we have something on demand at NP, PA overnight. Makes things so much easier. We don't have to call around. We go directly to the source. This is going on. We get orders, and it's very convenient. In some places, for example, this current contract, we have MODs, which are hospitalists. So it kind of sucks in this ICU because he might not have the scope of practice of intensivist. Orders might not be always something you want, especially if you're an experienced ICU nurse, and it could delay things. So it just depends. But most places, you have intensivists. It's straight business and to the point. You don't have to go and call and page and do all that, which I love as a nurse because, again, working other floors, it's such a drag getting contact with doctors, or they're getting grumpy because you called for Tylenol overnight. That's not the situation in the ICU anymore. Hey, doc, he's already awake. Let me just get some Tylenol. Cool.
It's super clutch. That's the one thing that bothers me a little bit about this hospital is you don't have that intensivist right there sitting with you. Like Santa Monica was super cool because we literally sat in the same hallway as the NP or intensivist. So the access was really amazing. And I was gonna bring up a point, but I really lost what I was gonna talk about. But yeah, Santa Monica was great. Like this stuff is a little bit harder to get in touch and get the orders you want. And you said there's a little bit of a lack of knowledge because this isn't like a super crazy acute hospital. So that's also a reason why you don't have such an acute service, you could say, because here they don't even do what did they not do here in the ED for the strokes? Oh, they don't have a cath lab.
They don't have a cath lab.
Yeah, so they don't even have a cath lab here, which is I'm not bashing the hospital or anything. It's a cool hospital. It's great. They do great services and they do provide great care. But this is probably one of the lower acuity hospitals that we worked in.
Yeah, you're just not used to the acuity of not having cath lab and getting sent out. Another pro of being an ICU nurse is having a larger autonomy and scope of practice of what you carry out. So as an ICU nurse, the doctor gives me parameters for potassium, for magnesium. I have access to a lot more PRNs, for example, heart rate control, blood pressure control. It's more standardized, and I don't need to call about little meticulous things. I just kind of carry out my task. I'm using my critical thinking and knowledge because of my autonomy to deliver the treatment. So I love that where I have a 12-hour shift. There's a lot of crazy things happening with my patient, throwing up. I have already everything PRN'd, and I just take care of my job, not necessarily telling the doctor about every little thing like pain, I need to order this. So I love the autonomy. And another thing is orders, like titration. That's another cool thing about the ICU here, which is autonomy. I'm modifying my drips and playing the balance beam of trying to get this patient off levo, monitoring his MAP versus looking at his neurological signs, seeing how he's sedated on the ventilator, and I'm going up on my propofol, Versed, or Precedex to make sure his RAS is a -3, which means he opens up his eyes briefly for 10 seconds but falls back asleep. So we're even being like chemists, which is awesome, titrating these drips and making it happen so the patient's mostly comfortable.
The 2-bag insulin, where if blood sugar is within a certain parameter, you got to do like 50% of D10 and 50% of I think it was like saline and something else. So that's pretty cool. Yeah, I love
autonomy. Yeah,
I love when I come into my shift and look at the MAR and look at the PRN and I see a bunch of PRN medication. I'm just like, yes, but then I'm like, sometimes I look at it, I'm just like, okay, there's a lot of PRN medication here. How sick is this patient? What the hell is actually going on? So it's like the more PRN meds, the sicker they are. But another really good way to look at it is the more PRNs you have, the more of a independent nurse you could be, because you could literally, if you have PRNs for blood pressure, PRNs for lights, PRNs for pain, PRNs for nausea, all that kind of stuff, then you're set, and you're just kind of like almost like the anesthesia, you could say, where you're just playing around with the meds, whatever the patient is having trouble with, you technically already have it, so you just give it. It's pretty cool. It's like playing the piano.
Yeah. Another perk of being an ICU nurse is the greater progression of your career to honestly every single part of healthcare. If you want to be a CRNA, which is the highest paid nurse, we could call that, you have that accessibility because you need to have ICU experience. If you want to be a doctor or progress there, you're going to learn so much about the human body because of having the ratios of 1-to-1, where you're going to understand the human body so much, and maybe you'll love and want to go to medicine. So I think it's a great stepping stone in nursing to do ICU if you want to progress on your career.
Yeah, definitely. I think I was about to say I think every nurse should work in ICU for a little bit, but I understand that not every nurse wants to work in ICU. So.
Biased there.
Yeah, super
labor
biased.
And delivery.
Super biased, yeah. And then also another pro is the ratios. They're 2-to-1, 1-to-1. Here in California, ratios have been amazing to us. In the Midwest, where we used to practice nursing, sometimes we get 3-to-1, and that was tough. But you get that luxury because most med-surg units, tele units, they're 4, 5, 6, depending on how you work. And like I said, like Matt said, it's cool because you get to explore your patient more. You get to be more in depth with their care, and that's another thing that really drew me to ICU, because it's nice getting to talk to people and communicate and do things for them and all that kind of stuff that comes in with tele floors, med-surg floors, and other floors where patients are more ambulatory. That's nice, but I just prefer having somebody that's critically ill where I could almost figure out how to solve on my own.
And regarding those ratios, just because it's 1-to-1 or 2-to-1, that doesn't mean that you're going to have an easier shift and you should get into ICU, because sometimes you're working more with that 1-to-1, patient on CRT, managing drips, changing him because he's pooping, versus having 5 patients. You do a lot of meds, you're busy 3 hours, and then you're chilling for the night. So the workload is there overall in nursing. It's a tough career.
Yeah, because I haven't done much med-surg stuff, but when I got floated in Oakland and I had like 5 patients, one day, they're all stable, which was nice. And I'm going to be honest with you, those 5 patients compared to 2 patients in ICU, those ICU patients were more work than those 5 on the med-surg floor. It is, I'm not saying every shift is like that. It just depends. That's why acuity is so important. But that's just why I prefer the 2-to-1 and 1-to-1s, because you don't really have to. I feel like if I have 4 patients, there's the more chance of those 4 being acute than those 2, because no matter what, if you have 4 acute patients, that's more than 2 acute patients.
That's a love-hate relationship.
Numbers.
Love-hate relationship of nursing, not knowing what's your acuity going to be, how your shift is going to go. So that little bit of anxiety, and in our contract now, not knowing where you're going to float. You might be anywhere, 2 different hospitals, but it's fun. Yeah,
it's a good time. I mean, the staff is great. Everyone's so helpful. Everyone's so nice. Like, I feel like every place we travel to, everyone is so nice. And we've all heard that travel nursing is bad because you don't get like approved to the unit, or people don't like you, or people hate you, or they want to give you these tough assignments. Like, sometimes you get a tough assignment. Yeah, it is what it is. Everybody eventually gets a tough assignment. Have you ever been a staff nurse for a month, you could say, and not have a tough assignment? It happens. It's gonna happen all the time. So for all of you that aren't travel nursing yet, y'all should definitely travel nurse, and also check out prontohealth.com.
Another pro of being an ICU nurse is less service industry feels. So because your patient is intubated, sedated, they're critically ill, you're not doing the little stuff of bringing ice, I don't know, doing a back scratch. I had to do like a 5-10 minute back scratch a couple days ago on my shift. I'm like, oh my gosh. And this lady was a pain in the butt. She had a dressing. Harder. Oh, you're pinching me. That's not scratching. And I'm just like, geez, man. So I'd rather just focus on the critical stuff versus the little tedious stuff, and not feel so much like, hey, we need to make sure these standards are of a 5-star hotel. Yeah. And that's like big aspects of, hey, ICU is awesome.
Yeah. Last week I had a patient tell me to reposition her legs, and then they're fine. She wasn't happy with how you positioned them, but she said they're fine because you come back in 4 hours and refluff my pillows.
See,
I was like,
you got to do that.
I was like,
man.
damn. I was like, okay. And so I was like, hey, having trouble sleeping? Yeah. All right, cool. And I can help you with that one for sure.
And what's funny with that is, technically, if you're a patient, the more often you come, you know what nurses do, and every single one has their best way to pamper patients. So eventually they know how they want to be pampered. So they just let you know, baby, you got to take care of me, comb my hair, Let me get that shower cap tonight. Can I take a shower? There's a lot of stuff that goes into it.
And then you're like, damn, I wish I was back at the ICU.
So let's just go into some cons now. One thing I would say is we get the worst of the worst. If you have an ETO patient that's not working, giving some Ativan, they come down, they're violent, grandma's crazy, restraints, mittens, they're trying to punch you, you need to get a Precedex drip. It could become a busy 12-hour shift, and you sometimes like get super annoyed because you come into nursing trying to help people, and here you're trying to like control this person because they're the devil right now. They're sundowning and they're going to ETOH. They're a different human and they don't even know who they are. Imagine this hospital we're working at right now, they want to do ICU diaries to write down and journal what happens with this patient. Imagine ICU diary. Yeah, you were crazy. You were restrained for 48 hours. You've been pooping yourself. You took poop and put it all over your face, and that's like the diary. When the patient goes home, they could read about it.
Yeah, imagine, dude. Imagine you being in a hospital for like 3 weeks and not remember what the hell happened, and you have this diary and you read it. You're just like, bro, this happened in 3 weeks. Like, I don't remember any of this.
Life's
like,
a
imagine
blur.
how crazy. So now that I think about it, like, because I kind of laughed it off. I was like, oh, create a diary. But now that I think about it, like, imagine being that patient and flipping through it. It's just like, whoa, this is what I went through, and I don't remember any of it, or I went through all this pain and this is what happened. Oh, it's crazy, man.
Yep. And the other like con of that spectrum is you don't get the worst of the worst. Now you have a crashing patient where for like 8-12 hours you're trying to save this patient's life. In some aspects you have 3 shifts in a row, same patient, you're trying to save their life, and they keep on crashing, getting worse. You're telling the family all this positive stuff and it's just not working out, and that becomes tough. Or you're hanging blood and you're doing all the tasky stuff, not on the emotional side, and you're just exhausted because you hung 3 units of blood, hung 4 different pressors, managing stuff, calling a gift of hope or organ donation service, and you're drained.
Yeah, so one of the main cons is the stress. It's a high stressful environment, and sometimes if you don't know how to properly deal with the high stressful environment, it does tend to carry over to like your social life and your outside of work life, because we are dealing with people that are on the brink of death, and it really gives you a different perspective of life, what it is, because you read notes and you have somebody there that's like 34 years old. Matt's 28 now. Happy birthday.
Thanks, bro.
And I'm 27, so it's just like not too far from where I'm at right now, and it's just like, whoa, like this guy's prone, he's on 2 pressors, completely sedated, paralyzed, and he's like 34, 39 years old, and you're thinking about like, not only is it stressful doing the work to keep him alive, but it's like you're also stressed kind of because you think about what he's going through, and you think about how much life he lived. So that is almost like a hidden stress, because it affects your energy and affects you emotionally, even though you might not think about it all the time like that. It does take a toll, and that's that added stress of that, you could say, emotional stress and that energy stress that you have, because it's very, and especially if you have like a tough month or a tough week where people just collapse on you, things just aren't going your way, it's just a tough month, you happen to have the hard assignments, and then you have family that aren't satisfied with the care, or there's a dilemma going on with the family because now there's a pressure sort going on, and there's nothing we could do about it because patient's been there for 3 weeks and he's not getting better, and it's a total cluster. It's a cluster of emotion, of stress, and if you don't know how to properly, you could say, numb it out or close that door and then reopen it when you come back to work, then you're gonna have a tough time in ICU, and that's definitely a con, and it does boil over if you don't know how to properly take care of it.
Something you made me think about. So we talk about stress, we talk about cortisol and the release of that having negative effects on your body. So if there's 168 hours in a week and 36 plus hours are devoted to high stress environment like working in the ICU, what are the long-term implications of spending that percentage of your life always in high stress? Because it's constant when stuff like that happens.
Yeah.
Like, what does that deplete our adrenaline? Do we feel more emotionally fatigued? Look at the whole pandemic where there's articles talking about burnout, PTSD, all that emotion, man. It's such a burden that's not talked about, that we have to carry with ourselves outside of work.
Yeah, and it's a different stress. If you're not a healthcare professional, if you're not a physician, if you're not a nurse, if you're not a CNA, registered therapist, or shout out to anybody else that's in a healthcare field, you don't really know what kind of stress we deal with, because we understand the stress of getting yelled at and ridden by your boss for not hitting these numbers or these metrics or not hitting your job goals. But the stress associated with caring for a human being, that if you mess something up, nurses don't make a lot of nurses don't make mistakes, and of course if mistakes do happen, but you're trying to keep this person alive, and sometimes they just pass away, and you are working with that person. You're going through their end of life stages, and you're communicating with the patient, you're communicating with the family, and you're like almost in charge of the whole situation. And that's stressful, because once that person is gone, there's nothing you could change or fix to bring that person back. And it's just a crazy ICU environment, and it's just, yeah, it takes a toll, man. Like, it's legit. Like if I had to work as an ICU nurse for 8 hours a day, like 5 times a week, I couldn't do it, bro. No way. It's horrible. It's always thinking about that every day. Always thinking about somebody may potentially die on me today. 5 days out of the week is way too much.
And that's what sucks too, because if you like work med surg and stuff, you could be like half in it, where you're planning an event outside of work and your patients are stable and they're sleeping the whole night and you're chilling, versus you have to be constantly in it and involved in your patient, because if something happens, you got to know things right away.
You're the rapid response team in like telefloors and stuff like that. You have the backing of a rapid response team, so you call rapid and people will come help you out. In the ICU, you're the code team, you're a rapid response team. You're the one doing all this, so you're just trying to figure that out. And it's super hard to figure out. Of course, you have a good team of collaborators next to you, your peers, your coworkers, but it's a lot of responsibility. And what's crazy about it is, what age do we start nursing? 22, 23?
I was 21.
21. So 21, 22, 23. Like, you're still young. You're still trying to figure out life. You're still trying to figure out why you're here, what's your meaning, what's the point of life, what is the meaning of life. And you get thrown into an environment where you see people die. It could be on a weekly basis, on a monthly basis, a couple of times a year. That's not something that a lot of people get to experience, and it takes definitely a toll, and it's a different kind of stress. But it's just like a double-edged sword. You're very fortunate to have it, but it's also like a curse, because you're dealing with that kind of stuff.
Yeah. Another con is the physical labor on top of the stress, because your patient is not able to participate in care at all. You are doing everything for them, including wiping them, they're peeing, you're turning them. And most hospitals don't have access to equipment, so you're doing a lot of the heavy lifting. You're doing the draw sheets. You are not having good posture. You're in between IV poles and cables, and you got to lift that patient up because they're uncomfortable, they're in pain, and I don't care what your posture is, I need to get off my back. So we all the time put ourselves second, and there's a lot of workplace injury. Look how our current contract involves all this like equipment and accessibility to that, because of the workplace injuries that could happen.
Like, think about your personal experience. Has there been a time where you maybe lifted a patient, you felt like something pulled, or like your right leg shocked or whatever, right? I experienced it too multiple times, and it just shows you, if both have experienced it, they're doing it in a hospital, it's a thing. A lot of it's in the ICU, because like Matt said, these patients can't help themselves. They can't help you turn. They can't do anything for you. And sometimes, being the independent nurses that we try to be, we try to take things into our own hands and in our own hands only, and we try to boost our patient up. Put them reverse Trendelenburg and a boost number or whatever you got to do by yourself, and then you end up pulling the muscle and pulling the back muscle, pulling the hamstring, and it's just, that's the reason why these workplace injuries happen, is because you try to do it by yourself because there's lack of support, or just because you're in a rush. And it sucks.
One thing I realized yesterday is I love hospitals that take care of the nurses and give them accessibility to equipment, because in this contract, every room has lift equipment, like the hover mat, where it takes like 90% of the lifting. You're just pulling the patient because they're hovering over air.
And for some reason, we still want to do it without it, but it's so easy to do. All you got to do is blow it up.
And a lot of places just have the boards. It's heavy physical labor. Another thing is, I was proning my patient yesterday. In most places, I'm manually reaching over with bad posture. Oh, I got to talk to the mic. Bad posture. I'm on an angle, pulling my probably right lat here, trying to lift them up so we could turn the head because they're intubated. Versus, there's a slings and there's what are those called? The lift
machine, yeah.
The lift machine at work. In every single room, I plug in the sling. all I'm doing as an ICU nurse now is I'm holding a button up. The patient lifts up, RT turns the head and stabilizes the ET tube, press the button down, and I'm done. Versus here, lifting and straining my back.
Yeah, man. And we had those in Santa Monica too, but we just for some reason chose to do it manually for some reason. Yeah, like utilize your equipment. I'll be honest with you. I don't utilize it as much as I should, just because I try to get in and get out. And but if you're gonna do that, just be careful, because you could definitely hurt yourself. There's no issue with using a machine. Don't be like embarrassed because you got to use a machine, or don't feel like if the patient needs something now, you have to get it now. Like, hey, tell them, I understand the day you want to go to the chair now, but I can't get you out of bed by myself because maybe you're partial weight bearing or they're post hip and they need some help standing up. Tell them that you got to get a machine or get somebody else to help you, or a walker or something, because don't feel rushed. This isn't a restaurant. This isn't a hotel, and patients should never rush you. You should never rush you, because then if you're gonna rush you, you're gonna be more prone to mistakes. You're gonna get stressed. So every time somebody tries to rush you, just let them know that, hey, it's gonna take some time. You're not the only one here, buddy.
Another con is the nasty wounds that we see. We deal with the worst of the worst. So if you are somebody that doesn't like to get their hands dirty, it's not the place. Sputum, we get a lot of that. Patients vomiting, blood coming out from different orifices. We see some nasty wounds, trach care.
Like some patients,
it's all, yeah.
Some patients are incontinent, but you don't understand the full potential of incontinence when you have a sedated, intubated patient that you're trying to have them poop. That's when I think of when someone tells me incontinence, like they're incontinent, I think of that, because that's a mess, bro. And when they're paralyzed and stuff and on tube feeds, it's a legit a shit show.
And a couple of days ago, I had a shift where for 8 hours, my patient was in pulmonary edema. We couldn't figure it out, so she was choking on her own secretions, and I was continuously suctioning her for 8+ hours trying to figure this scenario out. I was literally torturing her and I felt so bad, but it's something I had to do to save her life. And that's just, it's just a lot of nastiness that we deal with sometimes, and that's all part of ICU. So you better be ready for that if you want to partake in this specialty. Yeah.
Another con is most places don't offer more pay for ICU. So when you think of the ICU, usually people think of it as more of, I don't want to say prestigious, but more of it's more of acute care setting. So you're using more knowledge and more of your nursing school-based stuff than you are in other floors. So a lot of people would say that they should be kind of compensated with higher pay, but not a lot of hospitals do it, and they don't do it here in California as well. I guess this depends on per hospital basis, but I know in my hospital they didn't, and I kind of understand why, because we technically are all nurses, even though some of us work med-surg, ER, oncology, labor delivery, peds, all that kind of stuff. We're all technically equal. So maybe instead of just giving ICU higher pay, everyone should get higher pay.
And because of the pandemic too, now we've realized that if hospitals are going to get overflooded with critical patients, the ICU is where it's happening. And it's been busy as hell these past 2 years dealing with all this and trying to navigate through something we never navigated through, and that adds on to the emotional stress, to the more critical patients. Busier now we have to gown on all the time depending on what's going on. Patients are dying more. There's higher mortality in the ICU. You're dealing with more critically ill patients where the family's more emotionally stressed, where they might lash out on you. You might be dealing with a lot of emotional baggage there and just negative energy overall, and that just plays into the holistic life of who you are. Like you want to take all that on, because it's a lot. It's not made for everybody as a specialty, because if you're listening to this episode and thinking if you want to get into it, it's rough. It's a calling. It is rewarding, and I do love it, even though we are sharing all these cons.
Yeah, I'm trying to think of, like, is an ICU a fit for a specific individual? But then I'm thinking about all the nurses that I worked with in the past that were new to the ICU, and then I've seen how they developed and how they grew. I don't think there's a specific personality for an ICU nurse. I think your personality changes by the work you do. So if you're thinking about maybe doing ICU, but you're trying to figure out, hey, if I'm gonna go to ICU, do I have to be well in time management? Do I have to be well versed in grammar or how I speak, or do I have to know all these pressors ahead of time and all that kind of stuff? To be honest, you're not gonna know if you're gonna like the ICU until you try it.
You learn with experience.
Yeah, because given a person I am, I didn't look at the ICU as, hey, I need to hit these standards for me to be a good fit for ICU nurse. You just go there, you explore, you do what you're supposed to do, you learn, and like you'll grow into it. If it's a tough time in the beginning, just realize that nursing school is also in the beginning, not in the beginning, but learn that nursing school is also hard in the beginning. But guess what? You got through it, and now you're a nurse. So just because the ICU might be hard in the beginning doesn't mean you won't grow into it and ultimately love your career. But there also is the other side where you might try it out because you think it's a good fit and you might hate it, and that's completely normal too. There's no reason why you should stay in the ICU if you don't want to work there, if it's just not for you. There's so many nursing units out there. There's so many different ways nursing could take you. You shouldn't waste your time being and working in a unit that you don't like to work in. And that's why I'm going to push travel nursing here once again, because that's like the best way for you to learn.
Yes. And I just wanted to say that being an ICU nurse has humbled me tremendous. Talking about all these cons, sharing how like hard it's been absolutely humbling seeing all this shit. And it just gives me a lot of gratitude in life to everything that I'm doing, or seeing the worst of the worst and having these beautiful moments with my patients that gave me like gems of wisdom that I could carry with myself. You usually learn so much as an ICU nurse and experiences that you could apply to every aspect of your life. Just like, we say, oh, nurses make great entrepreneurs. I feel like being an ICU nurse, I've learned so much wisdom in such a short period of time that I could apply to my life.
Yeah,
it's been a blessing, man.
Yeah, for sure. I'm thinking now, how they associate the elderly with like wisdom, but in a sense, I think we all have our own wisdom, because if something, I don't want to say something happens, but so let's take this example for a second. So you have this wisdom in healthcare and wisdom in the knowledge, education you have, like being a nurse, and only you have that. You don't go through life and you don't experience life the same way somebody does that is like a financial planner. They go through life that way and they have their own wisdom regarding that. But the only way for them to be able to get knowledge regarding healthcare and health and compassion and being with people at the end of their life and how to treat them, that's the wisdom that he has to get from you. And that financial literacy stuff, that where to invest your money, you got to get that wisdom from him. So it's like we're almost like independent books. And if you really want to learn about life and about yourself even, you start by reading a book. And that's also started by talking to somebody else, because they offer you different perspectives and different way of looking at things.
That's why healthcare needs to take care of nurses better, to give us more time to spend time with these patients and meet those emotional needs. A great example is why I said it's like so humbling and it's like you're just exchanging that experience and knowledge. Is I had a patient that was a marriage counselor. I found out because I asked about his career. And I asked him, what's like the secret to a healthy marriage? He's a marriage counselor. He talks to so many people. Imagine the knowledge he has of thousands of hours of talking to negative people. He told me that the secret to a healthy marriage is honesty and communication. That's all it is. How simple is that? Look how valuable that information is that I've learned from this patient. Now I could apply it to my own life. And that's why I love nursing as a general. That's why I podcast about it and encourage nursing, because, man, it's awesome.
Yeah, that's deep, dude. That's very good advice for everybody out there. Communication and honesty.
Yes.
And they're right there, guys. Thank you so much for your time. See you next time.
Peace, guys. Have a great day.